So the best ways really are good hand washing, of course. You want to wash your hands with soap and water for at least 20 seconds. Or if you have hand sanitizer, you want to make sure you use that. You want to make sure you cover fronts and backs of your hands and allow the hand sanitizer to dry completely. That way it kills most of what's on your hands, viruses and bacteria. Also, it's so important to stay home. If you're sick, if you have respiratory symptoms, fever, cough, those type of things, it's so important to stay home if you're sick. You don't want to spread infections at your workplace or in the community. You want to avoid close contact with those that are sick as well too. It's also important to cover your mouth or nose when you're coughing or sneezing, and then hand washing after that. And don't touch your eyes, your nose, or your mouth, because those are your areas where viruses and bacteria can be transmitted, and you can get sick by touching those areas. So if you have concerns or feel like that you may be at risk for coronavirus or COVID-19, there are screening questions that we will go through, your healthcare provider will go through to ask travel history, or have you been around anybody that has been exposed to COVID-19 or confirmed COVID-19. And then they'll follow up and ask you, are you having any kind of fever or respiratory symptoms, shortness of breath, coughing. And if you do meet the screening criteria, then Conway Medical Center will consult with our Department of Health and Environmental Control, or DHEC, and they will further guide us in consultation with the provider whether or not COVID-19 testing is needed or not needed. And if it is needed, then we will collect it and it will be sent to our state lab in Columbia for to be resulted. As Conway Medical Center, we strive on keeping our community safe and our patients safe and our healthcare workers. So we are and have implemented screening of all of our patients in our clinics, in our emergency department, and our front entrances of our hospital related to travel, fever, and respiratory symptoms. And we've also have implemented some visitor restrictions too. So if you're sick, we prefer you not to come to the hospital and visit those, because we don't want any transmission of illness in our hospitals as well. We've also done a lot of education and prep for our healthcare workers on donning and doffing of your personal protective equipment to make sure that you're safe in your personal protective equipment. We've implemented specific isolation procedures for suspected COVID-19 patients as well. So this is a revolving and ever-changing situation we're in now. So as CDC updates guidelines, we will be updating our education too here at Conway Medical Center.